before you said you made a statement about the pharmacist becoming or the pharmacist's role in monitoring long-term therapies, mostly in chronic patients, a role that would be more like focusing on the conditioning, on the managing the condition rather than really only the managing the therapy.
That's correct.
Can you expand on that? Because that was quite interesting.
Sure. I believe in reframing the whole healthcare delivery system where the pharmacist has a bigger role in chronic care management. I think we make a mistake in siloing ourselves just to medications. We've always strived to be away from just a drug product. And one of the ways that we can increase that access to care and help countries with their resources is to be able to provide chronic care for patients, because that's where the need is. And I believe in matching the need with the capacity we have. We have extensive training and education on chronic care and chronic disease management. And I think we should be able to utilize that in how we treat the patients, how we care for the patients. So once the diagnosis is made, there's an ample need for our abilities and capacity to treat chronic care.
Yeah, excellent, thank you. And from your experience in policymaking and in governmental agencies, how do you see these policies? And you referred to processes of developing policy, or changing practices through policy, one being top-down, more like an imposition, sort of a policy imposed on professionals, and another one being the policy being developed from grassroots level. Could you expand on that?
Sure, and sometimes, as you know, with all policies, there is some resistance from the top if you aren't able to provide the full education to the decision maker or the full awareness of what's going on. So sometimes it takes the grassroots practice to inform the policy of what the right decision is to make. And I think with the outcomes we've shown and the evidence base we have, I think it's fairly demonstrated that pharmacists can do this healthcare delivery model. I think that the grassroots efforts will eventually change. In the United States, we have, state by state, we try to make the change. And then once enough states support a certain type of practice, it can usually be changed at the highest level of decision making. So I think the grassroots efforts is a good way to do it because it matches what the needs are. Of course, it'll always happen as well as from top down. So the more we can educate our decision makers right from the start, it's helpful.
And just one quick final question. How do you see the role of FIP, or an international organization that deals with policy making within pharmacy profession, in promoting that process?
Well, from the mission right off the start, the FIP's mission is to advance the practice of pharmacy. And what better platform than globally? I mean, we can come here, and I have the privilege and honor of coming here and speaking, being invited by FIP and the Dutch Ministry of Health to come and discuss some of the more progressive practices and what's been successful. FIP can spread that exponentially versus my discussions within the United States. So I think that's a great platform and venue and leverage your reach and network across the globe.